Welcome to the Organization for Nurse Leaders, Massachusetts, Rhode Island, and New Hampshire's presentation on using social media, communication tools to connect with peers, patients, employees, and experts. Today's presenters, we have a wonderful slate of speakers today, and I'd like to take a minute to introduce them. We have Jocelyn Strong. Jocelyn is a regional nurse executive with Kronos. She has partnered with nursing leaders at numerous hospitals and health systems to assess the gaps and efficiencies in current workforce management methods and recommended technology-supported changes to clinical workforce management structures and processes. With a background in surgical nursing and nurse management, she also contributes her expertise to ongoing product development of Kronos clinical staffing and scheduling tools to ensure they meet the changing demands of the industry. A self-labeled millennial, she's excited to share her knowledge of Twitter and the value of social media with ONL today. Next, we have Jennifer Ngure. Jennifer is the nursing informatics specialist at Spaulding Rehab. During her time at Spaulding, she has participated in various EHR implementation projects and provides nursing input and guidance to ensure computer application support and improve nursing workflow in the areas of practice administration, education, research, and the expansion of nursing knowledge. Next, we have Stephanie Altavilla. Stephanie has been a nurse at Boston Children's Hospital for the last 13 years, moving from a staff nurse in inpatient cardiology to an ICU clinical informatics specialist to the manager of clinical informatics. And now she is the senior project director for the new clinical building. She has her Master's of Medical Informatics from Northwestern University and is very involved in system design and change management. We also have Lee Williams, and Lee is unable to join us today, but was instrumental in helping to put together this program along with her colleagues. So I'd like to tell you a little about Lee. Lee is the program manager of clinical informatics at Boston Children's Hospital. Her prior experience and expertise was related to pediatric surgical nursing, as well as 8 years as a nurse educator for 3 inpatient surgical units. During her time as a nurse educator, she participated in the electronic health record implementation. During the implementation and ongoing EHR training and support, Lee became an informal informatics nurse. As a nursing informatics specialist today, she combines her passion of education with informatics. She is currently working on her PhD dissertation with a focus in nursing informatics competencies. The Nursing Informatics and Technology Subcommittee of the Management of Practice Committee is thrilled to bring you this exciting presentation.
Yes, thank you so much for those introductions, Mary. We have an exciting agenda here today, and we're going to start off by talking about first why social media is important and why nurse leaders really need to pay attention to what's going on and understand how they can utilize it. We're going to be then going through a few different trainings, focusing on first Facebook, then LinkedIn, and finally Twitter. And then we'll wrap up the presentation with a discussion around really guidance for and examples of social media use within practice today. So why is social media important? Let's talk a little bit about the value. In general, 33% of consumers are using social networks, and that's not limited to healthcare. It really is across multiple industries. And they're doing this to really discover new brands, new products and services, and really fully understand what's available out there. Specifically within healthcare, I think all of us as professionals really understand that even before a patient decides that they're going to seek out care or talk to a medical professional, they're out there on the web surfing, checking social media, and trying to understand what's available. The better we as nurses understand social media and really take full advantage of the tools available with it, the more likely we are to be able to influence what our patients and what the community is seeing and provide some more accurate and better information for them. Additionally, this is a recent survey that came out, and it was by the Ohio Hospital Association. Basically, the hospital commitment to social media is continuing to grow, so this is not something that's going away. There's been a big shift So about 70% of the spend is looking at 10% or more of overall effort on social media. So they're spending their communication dollars more on social media today than they were just 2 or 3 years ago. In addition to that, they're looking to expand and increase that spend. So this is something that's being budgeted to continue to grow into the future. And with this continued growth, there are, not really enough individuals sort of full-time allocated to deal with social media at these healthcare organizations. And so to really stay ahead of the curve, nurse leaders can take on some of this on their own and really create their own personal brand and connect with communities and experts really using social media. So to continue, why is social media important? So really the most commonly used social media platforms are the ones we're going to be focusing in on today. That's Facebook, Twitter, and LinkedIn. 91% of adults who are online are using social media regularly, and so there are a number of other forums to be aware of out there, things such as YouTube, Instagram, Google+, but we are going to focus on those top 3, and who knows, maybe we'll have some sessions down the road where we talk about the others. So really in summary and specifically, social media is giving you the opportunity as a nurse leader to be more strategic in your communications, really connect with patient populations in your area, and also to improve workforce development strategies, especially as you're shifting to really recruit and retain that millennial generation of employees. So with that, I'm going to hand off to Jennifer, and she's going to take you through some Facebook training.
So I'm going to review what is Facebook, why it's important for the nurse leader, and how to get started, some key terms, who to follow, and some Facebook's do's and don'ts. So Facebook is actually the largest social media platform out there. They have over 1 billion users, and 665 million of those users log into Facebook daily. So you get the most audience using Facebook. As I said, Facebook is the largest platform. It offers an opportunity to build a professional network. You can use it as a forum to exchange knowledge with your fellow nurse leaders and with your colleagues in nursing. You can use it to find out what's the latest research, best practices that are out there. You have organizations like the ANA who post the latest research or evidence-based research that's going on out there. And it also offers you a platform to listen to your patients. A lot of patients will go online and post real-time concerns or needs that they're having. So it is a good platform to be connected with because you're able to engage with current and former patients as well and hear what your patients are saying about your organization. Again, as I said, Facebook is one of the largest platforms. So basically how to get started with Facebook, you will need to log on to facebook.com, create your username and password. And once you signed in, they'll send you an email to verify that it is really you. You need to add your photo, organize your friends. The key thing with Facebook is to manage your privacy. Make sure you put out a professional settings for the people you want in your professional network to see what you're doing. And also, if you have a family network, you can organize your settings where just your families and friends can see what you're posting. You can also link it to other websites like LinkedIn and Twitter, so you can post to both sites at the same time. We have some tutorials that you could watch there on YouTube. It just shows you how to create a Facebook account, how to manage your privacy settings, and how to start using Facebook more efficiently. So some key terms in Facebook. One of the key terms is friends. So who are your friends on Facebook? And then also likes is just a way to acknowledge something that you've seen that you like on the page. How to share news feeds as well. Go to the next slide. So we've shared a couple of other organizations that you can follow on Facebook and link out to them. And I'll hand it over to Stephanie.
Great, thank you. So I'm going to talk a little bit about LinkedIn and its uses, some key terms, how to get started, how to join a group, and then, again, some of those do's and don'ts for LinkedIn. So for people who don't know, what is it? It's the largest professional network on social media right now. It's more than 300 million strong, and it's really a way to put yourself out there with resume, with job details and experience so that other people that may be looking for someone like you can find you. So some of the key terms are within the professional profile, there's sections for background, experience, skills, and education, and you really want to beef those areas up so that people find you when they're doing keyword searches. You can put in honors and awards, any certifications you have. Other people that are connected to you can endorse you for skills. They can also make recommendations on your behalf. You also, again, similar to some of the other social media sites, you make connections with other people. You can also follow groups, and you can follow people. So how to get started, the good news is Jennifer just walked us through Facebook account setup, and if you already have a Facebook account, it's very easy to set up a LinkedIn account. You can link it right to your Facebook, or if you don't have Facebook or you don't want to link your accounts, you really just have 4 simple questions. It's your first name, last name, email, and password. And again, we put in a link so that you can watch on YouTube a quick tutorial about setting up a LinkedIn account. Once you set it up, it's highly recommended that you also download the mobile app so that you can stay up to date. And again, you can set your alert settings so that you can be alerted on your phone or not alerted when different things are happening within your LinkedIn network. As you start to grow your LinkedIn profile, your different groups will be suggested to you. If you have informatics in your background, you may start seeing some informatics groups that are suggested that you may want to join, and you can just click on them and go ahead and join them. So some of the do's and don'ts, obviously you want a professional photo because this is really your online resume. You want your professional history and your experience, and you want it to read well. You have to proofread this. Imagine this as your resume. People are not really looking at paper resumes anymore. They're looking towards social media to find information about potential candidates. So it should be absolutely proofread. There shouldn't be spelling mistakes or grammar errors. And you want to make thoughtful connections. So you want to make those connections with professional groups because as you make a connection with a person, they can see who else you're connected to and the groups that you're interested in. So again, you want to make thoughtful choices when you're choosing those connections to make sure that you're not putting something out there that you wouldn't want a potential employer to see. Really use it as a social platform and a professional platform. And solicit recommendations and endorsements. If you know you've worked with someone that really enjoyed working with you, you can certainly ask them to put in a recommendation on LinkedIn for you. Some of the don'ts is don't use it as avoid personal interests. So again, I talked about the making thoughtful connections. You really want to make sure you're making those personal interests on a different social media platform where potential employers are not finding you. You don't really want to initiate personal and family connections from a patient's perspective, and you don't really want to use it as a social platform, really much as a professional platform. I'm going to hand it back over to Jocelyn, who's going to talk about Twitter.
So Twitter is an information network, so millions of people and users utilize it today, and it's known in a lot of ways as a micro-blogging platform. So each user can post a number of entries to their blog, but they have to be only 140 characters or less. It is a very well-utilized social media platform with over 200+ million users and 400 million+ tweets per day. So why Twitter? Why is it important? Well, Twitter definitely is not just for millennials, and actually the fastest growing demographic on Twitter is that 55 to 64-year age bracket. that particular demographic has grown 79% since 2012. That really focuses in on that baby boomer generation. So as people are getting to the point in their lives where maybe they're going to need a little bit more care or medical attention, they are also taking to social media such as Twitter and getting news and information there. Additionally, it's a place where you can get a lot of information from a lot of different people. So we have patients there, they often post about their experiences at the hospital or experiences with various personnel within, a healthcare organization. Policymakers are there, so it's a great place to stay up to date on what's going on. You have influencers there, whether that's professional organizations or professional journals that you want to stay up to date with. And then you also have experts as well as your employees are expecting an organization that they work for to have some sort of a presence on Twitter. So this is, just a number of reasons why Twitter should be something that's a focus of any social media strategy. So why use Twitter? What are the overall objectives? You're really trying to generate awareness of you and start creating a personal brand or of your organization within that social space. You're looking to identify any sort of relevant industry conversations and really give your or your organization's point of view, helps to maintain a credible reputation. And then you also want to engage with other social audiences and patients and build relationships with influencers. Finally, you can increase employee participation and, even recruit and attract new employees through the use of Twitter. And then finally, it's getting real-time news and opinions as well as events that are ongoing. In terms of getting started, you're going to go to www.twitter.com to create an account. You have to create a Twitter handle, and we do recommend that you use your name for that. Definitely you want to add a photo that's going to, let people see who you are, give sort of a face to your name and understand you a little bit more. And then add information about your, organization, whether that's your website, your blog, or even you could insert your LinkedIn profile link there. And then a quick bio to, tell a little bit about yourself. Then you can show your personality through, use of wallpaper. And just like with the other platforms, we did include some brief video tutorials. I don't know if somebody needs to just put themselves on mute. There we go. And so these videos, we'll make sure that you have a link to these slides so that you can, be able to access them and get a little bit more in-depth information on the specifics of using both the mobile app as well as, Twitter in general. Some key terms. So a tweet, again, those are those short messages or micro blogs. To follow is to be able to subscribe to someone else's tweets or updates. And if you have a follower, it's someone that is subscribing to you and getting the updates that you post. Again, you can mention or reply at somebody to refer to a particular other Twitter user. And you can share someone else's content by retweeting. Additional terms, the hashtag, that's a symbol, that's used before a relevant keyword or phrase, and it can help to categorize or look up tweets or information about a particular topic. And you can bookmark things by using favorites. You're also able to send direct messages to individual users. And then Follow Friday or hashtag FF is often used on Fridays when people want to make recommendations to their Twitter audience about who else to follow. And then just a quick peek at what the homepage layout looks like on Twitter. Down the left-hand side, you have sort of your bio, some recommendations of who to follow, and then also what's trending, so what are people talking about right now on Twitter on the bottom left-hand side. And then on that right-hand side, you have your search, you have the capability to compose a new tweet, and then finally you have the timeline. So as people are posting things on Twitter, individuals that you follow, that's where that information would be updated within the timeline. drilling in a little bit deeper in terms of navigation, access to your home page, the connect area where you'd look at interactions and mentions, discover, so how to search hashtags, and then, of course, you can look at your own profile. Again, this is really a tool for reference in the future as needed and as you're getting involved using Twitter. Pretty much the same features and functionality are available in the mobile app, and I would say I use the mobile app a lot more regularly than I use, just web access on my computer. It's easy to do on the go. You get the same amount of information, and it's really a quick way to get to the Twitter screen. And then in terms of what to tweet, so I think a lot of people are nervous about getting started. Generally, you want to tweet content that you think will interest your overall target audience, whether that's relevant news, posts from your own blog, information about upcoming events, or retweet other articles or information that you found to be particularly interesting. You can also post rich media, so definitely videos, pictures, slideshows, et cetera. They tend to, make a statement and get some attention on Twitter. You're also able to start a conversation by tweeting at a particular Twitter handle or sending a direct message. Some tips for tweeting. Try to keep your tweets to 120 characters or less. So even though the max is 140, if you keep it to 120, then it'll be easy for someone else to retweet your information, maybe add their own personal comment to it. We also recommend doing frequent tweets, and 60% of Twitter users do access on mobile. So if you're not tweeting frequently, you won't be seen. There's just so much information being posted. Definitely at least one retweet per day and one original tweet per week, but the more the merrier if you're trying to get out there. And then Twitter will automatically shorten URLs for you. As you're typing that in, they'll condense that so that you don't have to count all of those characters if you're, posting a link to a blog, say, within your 140 characters. You can also use a shortener such as Bitly, and I've included a link to the Bitly site there. These are just some examples of, a good tweet versus a bad tweet. A good tweet, HIMS is posting about a particular example and story that they want to share and an upcoming event, versus on the bottom, somebody's just tweeting about, they're making popcorn. So it's something that's not really relevant or, worthwhile to share to a broad audience, more or less. And really, if you're looking to build a following, you want to start with who you know. So on Twitter, try to connect with colleagues. You can import contacts from either Facebook or from your email to see who else is already on Twitter and then get involved with them. And then start following folks with similar interests. And those with similar interests often will be recommended to you under that who to follow category. And here are a few suggestions that this group sort of put together. So the top 4 are your list of presenters there. And then we've also just included some others within the medical and nursing community that would be good to follow. And then also some organizations that we think are pretty active in terms of healthcare tweeting. To increase visibility within the Twitter space, you want to make yourself findable, so you can add yourself to different Twitter directories and use hashtags frequently. Generally, the use of hashtags is going to categorize tweets, help them show up more in searches. Some tips, you don't want to use any spaces or punctuation because that will change your hashtag. They're used on Twitter. They can also be used on Facebook and LinkedIn. We do recommend no more than 2 hashtags per tweet because it can get to be a little bit too busy and a little too much. So how would you use hashtags? What are some examples? So you can talk about subjects, events, places, things, verbs, or again, that Follow Friday. Those are just a few examples of relevant hashtags that can be used. Additionally, you could participate in tweet chats, and tweet chats are really a way to connect with others in the social media environment that you might not otherwise connect with. I've listed here links to the top 5 healthcare tweet chats, and then also a full list of healthcare tweet chats by date and time. So if you're looking to get involved on a particular topic within healthcare, certainly take a look at those. But really, you'll start building relationships over social media. And then some do's and some don'ts. You definitely do want to represent yourself as a nurse leader, be able to state your opinion on current events and topics, and be active. If you want to build a following and maintain a presence, you have to regularly contribute. And then don't make negative or rude comments or statements. Don't necessarily engage with or respond to people that have irrational complaints or ideas. Sometimes things that might come up either from a dissatisfied patient or a disgruntled employee, often they can take to Twitter. It's best to, work with your PR or maybe your own internal social media team to decide how best to respond to those things. And of course, you wouldn't want to post any items containing, private information or info that you wouldn't otherwise share with the media. And then we've put together a plan. It's, really a 5-week plan of getting yourself up and active on Twitter and really becoming an active participant. And we've created the hashtag MARINHONL, which is a little bit of a mouthful, but encompasses, really the entire organization. So hopefully we'll see some activity with that particular hashtag in the upcoming weeks. And with that, I'm going to hand it back over to Stephanie to really put it all together and talk a little bit about some best practices in social media use.
Great. Thanks, Jocelyn. So we just wanted to put out, as you've heard about all these social medias, really some guidance around it, just in general. And to talk about, we have a professional work environment. We need to maintain those professional boundaries with everyone, with patients, other staff members, families. We also have to, it's our job to really make sure that PHI is not disclosed in any way, and that people are using it in a manner that brings out the best in the organization and as Jocelyn was saying, doesn't go to the social media to really show their disgruntledness or upset manner with the hospital. And we also really want to make sure that time spent online doesn't distract from patient care or other work obligations. So at Boston Children's, we do have a social media policy, and we've just put some of the key points out here, which really it's for personal purposes while providing patient care is prohibited. So we've really said to our clinicians that, we know you have iPhones on you, we know you have Droid phones, and those are important clinical care pieces of technology to provide clinical care, but we don't expect you, we expect that you're not on social media while you're using those devices. We really call out that there's a respect for professional boundaries and that we actually do not permit initiating an online relationship with a patient or family at all. So they can accept an invitation, but they're actually not allowed to accept an invitation while the patient is in a current encounter. And really, we try to discourage it at all costs, but there are some patients and families that, have made such an impact on a clinician's life that they would like to stay in touch with them. But again, they're not allowed to do that while the patient is currently an inpatient, and they are not allowed to initiate that relationship at all. We call out that we're never to disclose patient health information, any confidential or sensitive information about anything, whether it's the patients, the families, other colleagues, and hospital operations. And again, that social networking and use of social media should not distract from patient care or any work responsibilities at all. So I think Jennifer's going to end this today talking about creating a social media presence.
So we're going to just review a couple of ways we can use social media to enhance your organization. So at Spaulding, you can see on our Facebook site, you can see Matrix, see how many people have logged onto your page, how many people have liked it. You can also see trends, like if there's an increase or decrease in the past couple of months. So depending on, you're able to measure matrix and see how active your Facebook site is for your organization. And you can do the same for your personal Facebook as well. We can also use tools like LinkedIn for recruitment. As you can see, we posted a job fair. So it's a free recruiting tool. You can use it for your organization. You can use it to reach out to the millions of people who are out there using the social media tools. You can also use it as an educational tool. So we do have Twitter brand rounds, so hashtag rehab rounds. So we have our physicians go on and people log on to Twitter. So you can use it as an educational tool and as an outreach tool as well. You can also use Facebook. Patients, as you can see, use Facebook to give feedback about your organization. So here we have a patient who was admitted, was writing that they really enjoyed the stay at the organization, the care they got, and you get compliments. So it's kind of a good way to get feedback of what's going on and a feel of what patients are seeing and feeling about your organization. So again, we want to thank everybody for taking the time to listen to this presentation. You can reach out to us on Twitter, and you can also find us on Facebook as well. Thank you again for your time.
Thank you, everybody. You did a fabulous job, and we look forward to hearing back from members of ONL. Thank you.